Now, tinnitus on its own can already be annoying for some people, but what makes it worse is when you accidentally keep feeding it. And no, I'm not here to tell you to just ignore it or just relax, because when it comes to tinnitus management, that is probably one of the least helpful sentences. Today, I'm going to talk about 5 things that can accidentally make tinnitus worse, and more importantly, what to do instead. But before I dive in, I want you to make sure that you like this video and subscribe to our channel. My name is 𝘹𝗿𝗃. I'm a doctor of audiology, and I've helped hundreds of people in the Toronto area to achieve better hearing and solve complex cases of hearing loss. And I've also worked with many tinnitus patients to help improve their perception of it day to day. Now, first thing, silence. One of the most common things that I hear is, my tinnitus isn't so bad during the day, but as soon as I climb into bed at night, it's just so noticeable. So that's the contrast, right? So that's because when your bedroom is quiet, your brain has less external sound to focus on. And that's why your tinnitus becomes the main event. Often it's that shift from daytime ambient noise, but also just distractions, to quiet bedroom where our attention is really heightened towards our tinnitus. And I tell people, it's not probably any louder than it was during the day. It's you've taken away all of those distractions. And so laying in a quiet room, now your tinnitus is the thing that you're hearing more obviously. But it was probably just the same volume throughout the day. So what can you do instead? This is probably one of the easiest and most simple solutions anybody with tinnitus, whether you have normal hearing or some degree of hearing loss, that can be done. You want to add a bit of low-level sound in the background. This can be a fan, this can be rain noise, this can be white noise or pink noise, but just a very neutral sound that fades into the background. Our goal isn't to put a sound on loud enough to cover our tinnitus or a sound that's going to create a new distraction. We want a very low level sound that's just on and in the background. We don't want loud, we don't want blasting, just something in the background to give your brain a distraction. Now, I usually tell people it may take a couple of nights to figure out what's the right sound for you, but you want something very neutral and you honestly just want to leave it running. Now, although this seems like a very simple change, for some people, this can be the difference between tossing and turning because of your tinnitus and a great night's sleep. Number 2, loud noise exposure. I'm sure we've all experienced it. We've been to a loud concert and we left with our hearing feeling a little bit muffled, or we left with our ears ringing. And that's just because that loud noise exposure temporarily created a change. Now, you can imagine if you have this baseline level tinnitus and we're going to a concert, we're mowing the lawn, or we're using power tools without hearing protection, we run the risk that we can either see temporary or permanent fluctuations in our tinnitus. So when we're being exposed to loud noise without proper hearing protection, we're poking the bear. So noise exposure can create temporary, or with prolonged or repeated noise exposure, permanent changes in our tinnitus and our hearing. So what to do instead? Wear hearing protection. Now, of course, it's the right type of hearing protection, because oftentimes one of the reasons people don't wear hearing protection consistently is because they feel like it's not helpful. And it may just be something as simple as not wearing the right type. If you're going to a concert, you want to be wearing what we call a musician's plug or a filtered earplug. That'll allow you to hear the music just as you intended, but the overall volume is going to be safe. If you're mowing the lawn, if you're using a snowblower, if you're at the gun range, you want to be wearing earplugs or earmuffs, or sometimes both. And day to day, we have to think about our headphone use. One of the things I talk to people about all the time is we need to make sure that we're listening to our headphones at a comfortable volume. I shouldn't have to raise my voice or get you to take a headphone out for you to have a conversation with me. We should be able to do that at a comfortable volume while you're wearing your headphones. Tinnitus management is going to really focus on not having your auditory system work harder than it needs to. Now, the third one, this is a hard one, but poor sleep or sleep hygiene. Now, we all know sleep plays a huge role in anything we're doing day to day, including our tinnitus. Sometimes Bad sleep or poor sleep and tinnitus can almost be like a toxic little friendship. So tinnitus makes sleep harder. Poor sleep can make stress worse, and stress can make tinnitus seem louder. So it's almost like this vicious cycle where sometimes we can't sleep because of our tinnitus, and our poor sleep is making our tinnitus worse. So what do we do instead? Well, I want you to go back and look at point number 1. I want you to introduce a sound machine because that will help build good sleep hygiene. How can we reduce our tinnitus because of sleep? We really want to think about creating really boring but good bedtime routines. If we can go to bed at the same time every night, if we can avoid screens, so no doom scrolling for 2 hours before bed, introduce a bit of low-level noise in the background. Give your nervous system a runway to land. Now, if you're looking at what types of sounds are great sounds for sleeping, check out some of our videos that we'll link in the bio. We have things like waterfall sounds, white noise, pink noise, brown noise. Those are all sounds that in clinic, oftentimes people feel are really soothing and neutral and just help with sleeping. Number 4, we're looking at stress and anxiety. Now, of course, this part is easier said than done to manage, but it is an area that we have to focus on. And oftentimes when we're looking at tinnitus management programs, there's always going to be an area that's focused on stress reduction. Tinnitus isn't all in your head, but your brain can play a role in how bothersome or threatening it may feel to us. When your nervous system is in fight or flight mode, your tinnitus may just be more intrusive. So what are we going to do? We're going to use exercises aimed at reducing stress and anxiety. I want us to look at how can we reduce stress. So we're going to think about relaxation techniques, mindfulness, meditation. Consistency is key. This is something where I tell patients, take 10 minutes at the start of the day and the end of the day and do a guided breath work or mindfulness course. If you ever feel like you need that extra little bit of help during the day, set aside 3, 5, 10 minutes and do one during the day as well. If we can reduce our stress as much as possible, it's going to have a really big outcome in terms of how much is your tinnitus impacting you. Counseling with tinnitus management is crucial. Working with a psychologist, a psychiatrist, and a cognitive behavioral therapist, those are really excellent options in managing our tinnitus. For some people, it's not actually the loudness or the volume of our tinnitus that's bothersome, kind of the emotional reaction we have to our tinnitus. And so if we can work with a counselor to address our negative thoughts surrounding our tinnitus and think about how much we can change that by putting them in a more positive light, or just changing our negative thought association with it, we can see some really impactful results in our tinnitus. I always tell people too, working with a mental health provider or CBT is great. Those tools you're going to use or learn to manage your tinnitus, those can also be applied to many different situations in the future. So although you're using them for tinnitus management, any stressful event in the future can be helped with those tools you're learning today. 5, ignoring hearing loss. This is a big one. Many people think tinnitus may be the problem, but underneath the surface, it may actually be untreated hearing loss. When the brain is missing sound input, tinnitus can become more noticeable. For a lot of people, hearing loss and tinnitus coexist, and we see a lot of the times when we improve someone's hearing, their concerns with their tinnitus often decrease. One of the things I always do is I get people to fill in the hearing and tinnitus survey because that highlights, well, are a lot of your concerns actually hearing related or tinnitus related? And whichever area is driving that score first, we manage it. Oftentimes what I'll see is sometimes concerns we attribute to tinnitus are actually related to our hearing loss. And we'll see a big step in a lot of tinnitus counseling programs is if you have a hearing loss, we need to improve that with the use of hearing aids because that often alleviates a lot of the symptoms associated with tinnitus. If we can improve your hearing loss and create a richer sound environment using tinnitus, similar to other things I talked about we're going to notice a reduction in your perception of your tinnitus because your brain isn't focusing on the tinnitus. It's focused more so on all of that sound it's not used to hearing. So it's one of these things where often people come in and they want to have an appointment related to tinnitus, but we have to veer the conversation to hearing loss. So what to do instead? Get a proper hearing assessment. And no, not a 5-minute quiz you did online that tells you how old your ears are, or a no-cost hearing screening. I want you to go into a clinic and have a full, comprehensive hearing assessment done. Because if hearing loss is part of the big picture, hearing aids may help by giving your brain access back to these sounds that it's been missing. So the 5 things that can make tinnitus worse are silence, loud noise, poor sleep, stress, and untreated hearing loss. The goal is not to fight or mask your tinnitus. The goal is to reduce your brain's need to monitor it, ultimately leading to you noticing it less. If this video helps you, like, subscribe, and share this video, because we all know that one person who's struggling with their tinnitus. And remember, tinnitus is real, but it doesn't have to be the whole show.